So the definition of regional anaesthesia is the injection of a local anaesthetic adjacent to a peripheral nerve, with the idea being to temporarily block the conduction, and so the sensory afferent, and it might also be the motor efferent activity in the region that's innervated by that nerve. And just in contrast, we will be talking about neuraxial anaesthesia as well. That's drug delivery into the extradural, which is an epidural, or the subarachnoid, that'd be a spinal intrathecal block. So just to recap, analgesia is the absence of pain in response to a stimulation that would normally be painful, whereas anaesthesia is a loss of sensation. So we're focusing more on the anaesthesia side of things today. So we're trying to temporarily block any sensation in that nerve. So just to recap on the local anaesthesia and as a whole, there are different types. You can apply it topically, such as Emla cream. You can locally infiltrate around the site of surgeries. People use wound catheters more commonly. You can do splash blocks, just putting anaesthetic on the site of surgery. And then there's the regional techniques, which we're going to concentrate on today, where we inject close to the nerve. There's the neuraxial techniques. You can also put intra-articular injections. We're not going to touch on that so much today, but that might be beneficial as well if you're doing lots of orthopaedic surgery. And then also intravenous regional anaesthesia we will mention, because that is also quite a useful technique for some distal surgeries. So just to mention the topical ways of applying drugs, useful in practice, this is Emla cream on the skin for when you're putting IV catheters in. The problem with applying local anaesthetic to the skin is it's a really good barrier and drugs find it difficult to cross. So Emla cream is commonly used in veterinary practice. It's a eutectic mix of lidocaine and prilocaine, and it's in an oil and water emulsion. So eutectic means when there's two compounds mixed together, the new substance has its totally different set of characteristics. And there was a study published last year in dogs where they found that if they applied the Emla cream for 30 minutes or 60 minutes compared to no cream at all, and they compared the response in the dogs to having IV catheters placed, and they found that there was much less behavioural response if they applied it for 60 minutes. So if you do have a stressed or dog or a cat that's not tolerating, you think you might have trouble with, it is worth applying for 60 minutes under a dressing. We also use local anaesthetics in the eye, so proctimetacane might be used for short-term anaesthesia for diagnostics or in surgery. And then also we can apply mucosal lidocaine gels, which you can apply rectally, for example. So moving on to regional or neuraxial anaesthesia. Why should we bother? Because at the moment, you know, and historically we used to just get away with non-steroidals and opioids and not be doing nerve blocks. And there's been a huge move, especially in human medicine, to perform regional anaesthesia. So the aims are to provide a sensory blockade during surgery and hopefully some post-operative analgesia as well. And we want to try and minimise the motor blockade, or if there is a motor blockade, we want to have a rapid recovery so that when the animal wakes up from the anaesthetic and has had orthopaedic surgery, they can move around and they're not distressed by not being able to move their limbs. And also ideally you would get some muscle relaxation that would help with surgery. So in people, they found quite a few advantages for performing blocks or epidurals. They found in studies there's less perioperative opioid use when you perform a block or have an epidural. They also found lower mortality rates, up to 1/3 reduction in death just by performing spinals or epidurals. And there are also better outcomes, shorter hospital stays, less urine retention and less ileus. So overall, they found lots of benefits from performing local blocks as opposed to the traditional ways of just administering systemic drugs. There's been studies in veterinary medicine as well. We found there's better and more prolonged analgesia compared to traditional opioid administration. And they assess these by doing pain scores on the animals and also assessing how much fentanyl they needed in surgery. And they found that overall it's better. They've also found that performing blocks obtuns the stress response to surgery. So when an animal has a major operation, there's a huge stress response that starts in the body. But by providing regional anaesthesia, we can prevent that even happening. And lastly, peripheral nerve blocks, such as femoral sciatic nerve blocks, have the advantage that they don't cause hypotension that you might find with an epidural. So there are advantages and disadvantages of both, but these are some of the beneficial things that have been found.